We are looking into the impact of the recently signed federal budget known as the Big Beautiful Bill and what effect it will have on health care. Danita Harris is in Studio B with what's ahead and the cuts already happening here at home. Hey, Danita.
Hi, Dave. Let's talk about this. From cuts to Medicaid to Planned Parenthood, the Cleveland Department of Public Health is working to ensure patients don't fall through the cracks. We know that's a big concern. The City Commissioner of Health, Francis Mills, is here with me this morning, and we're going to take a look at what's being done. So, Francis, you see firsthand what the patients are in need of. When they come to you, what are they saying?
Patients are having a difficult time accessing care. And so what this bill means is that people will have a more difficult time accessing care. When we talk about the Medicaid population, we are talking often about people who have difficulty with transportation, difficulty with childcare, difficulty with food insecurity. And so there are a number of things that are going on in addition to the barriers to just getting care. Yeah. And so adding restrictions and reapplication processes that are more difficult than they currently are will be a big barrier for folks getting care. So
yeah, let's look into this big beautiful bill right now. Let's get some more specifics, okay? Let's take a full screen now. The bill cuts roughly $1.1 trillion in healthcare spending, and the Congressional Budget Office says 11.8 million people would actually lose health insurance over the next decade. So here's the next question. How is this going to impact the community? Because this is major.
Well, for the city of Cleveland, roughly around 40% of folks are on Medicaid. And so we're talking about the addition of work requirements for individuals who may not have had to work to attain benefits before. They will have to prove that they've worked at least 80 hours a month.
Let's deal with that. Okay. 80 hours a month, they got to prove that. How is that going to work?
Well, the rollout of that, the rules and the process, the procedures, that's what the community is waiting on. Mm-hmm. So Job and Family Services will get their directions and how that will be accounted for individuals, but they're estimating 25 to 35,000 people will have to begin work.
Jeez. All right. Well, let's talk about Planned Parenthood. We know the Cleveland office, we reported that they got cut, so they were sending people other places. But what about now all the funding being cut possibly for Planned Parenthood? How is that going to impact?
Well, as of last night, there was an emergency injunction. And so it's now in the courts. And so over the next 2 weeks, we'll see what happens in terms of permanent funding. But the work still goes on in Bedford Heights and Old Brooklyn and Rocky River. It's very interesting that a center in which care is needed the most right down in the near downtown area, that's the office that was closed. And so what it means to lose Planned Parenthood, simply less services in the community, mm-hmm. less primary care, less cancer screening, less sexual health education, less access to birth control for folks. And when people think about Planned Parenthood, they think about abortion.
That's what I was going to say. There's a misconception about it, and that's all you hear about is Planned Parenthood and abortion in the same breath.
There are so many people who have gotten their health care, both men and women, from Planned Parenthood. I've heard stories from people who said, hey, Planned Parenthood caught my cancer in time. Planned Parenthood caught a brain tumor in time. Planned Parenthood changed my life, taught me how to eat correctly, got me to the places where I needed to get to improve my health. And so that's a loss to the community. The Department of Health has partnered with Planned Parenthood for many, many years in terms of the work that we do in the reproductive health space. And so it's less services in the community.
With all this happening, how's that affecting your budget, the public health department budget?
Well, budgets are strained both at the county and the city level.
Okay.
And so this is just one bill that's affecting so many things, but earlier in the year, there were additional cuts. And so public health is that service that is behind the scenes that protects and saves lives and prevents disease and averts disaster.
Right.
And so we've seen cuts happen on our emergency preparedness side. We've seen cuts happening on the maternal child health side. And so it's the cumulative effect plus this bill that is going to have a serious impact, whether it's, we've seen what happened with the food banks. And so we're going to see less services, more need, more uncompensated care, and at the end of the day, we think higher costs for everyone.
And more frustration. People are just frustrated with this. All right, well, Frances Mills, we thank you for being here today, the Cleveland Commissioner of Health. This is a very important issue, not going away anytime soon, it seems like, but as you're saying, we just got to keep fighting and keep hoping, right?
Yep. Cleveland Public Health, available for women needing reproductive health care. If you need services, you can come to one of our 2 locations, 4242 Lorraine and 1100 St. Clair Avenue.
All right, Frances, thank you so much. Appreciate you being here today.
Thank you.